So the common fear is that if I go to a surgeon, then the surgeon will always recommend surgery, and I don't want to undergo surgery. That's how the patient feels. So most people then go to quacks or unqualified doctors, and you have so many advertisements in the train, in the railway platform saying that 100% cure without surgery, and then you tend to go there and you end up with problems. So remember, most piles, more than 3/4 of the piles do not need surgery. As a surgeon, I treat almost 75 to 80% of my patients of piles without surgery, just with medicines. So not all piles need surgery. So if you think that if you go to a surgeon, the surgeon will 100% operate on you, that's a wrong thing. You should, that is not true. So you must go to a surgeon, get yourself diagnosed, and then treat. If you're not happy with the surgeon, get treated by somebody else. But make sure that you go to first to a surgeon and get yourself diagnosed. It's only piles which come out of the anus and you have to push them inside. Then those are the ones which will need surgery. But those are hardly constitute about maybe 15-20% of the patients. Most patients, that symptom is not there. And even if you go to get surgery done, we have really very good, relatively painless methods to do this surgery. So you don't have to be scared that if you go to a surgeon, surgeon will operate. First of all, it's more likely that you will not need surgery. And even if you need surgery, there are now quite relatively painless methods available. And you can then get back to work also in that case. So as I said earlier, when I talk about treatment for piles, I said most piles are treated without surgery. What do I mean without surgery? So as I explained to you that the piles are formed basically because of straining, sitting for long hours on the toilet seat, and a little bit of constipation, where patient is passing hard stools. So what you should do, if you correct all this, maybe most of the symptoms disappear. Also, you have medicines for that. So let us talk about first the non-medicine, non-drug therapy. Nowadays, we notice that the mobile phone, which everybody has smartphones now, they take it in the toilet. And when you're on the smartphone on the toilet seat, you don't realize the time because you're on the your smartphone is your email, your newspaper, your whatever episode of some show you're watching, everything, and you tend to sit there till you finish that, which is absolutely wrong. So we always tell the patient strictly not to take the mobile phone in the toilet. There are better ways to see your mobile than on the toilet seat. That will cut down your time that you spend on the toilet. So the more time that you spend on the toilet seat, the more the chances, the pressure is there on the lining, and the more chances of that lining, the supporting structures to the lining breaking down and the lining sliding down. So first thing is do not sit on the toilet seat for long. That's very important. Second is do not strain while passing stools. If you're straining, you tell your doctor to prescribe you a mild laxative by which you pass stools easily. So simple thing like just not straining and not sitting for long on the toilet seat also can help you a lot. The third thing is the diet. People and neighbors and everybody else will say, oh, you have piles, you should not eat non-veg, you should not eat this. No, eat normal food. Just see that you maintain an adequate balance between your fiber and your non-fiber diet. You don't have to stop everything. You don't have to have boiled food. You don't have to stop non-veg totally. It's not necessary. Just have adequate fluid and fiber in your diet. That's it. You can give water, not excessive water also. So just by this, without any medicines, most of the symptoms can get treated. Now coming to the medical therapy, there are some medicines available which can help in stopping the bleeding. So if you have bleeding and you take these medicines actually strengthen the walls of the veins and prevent the bleeding from taking place. So they can help you. So this drug therapy, along with the diet and toilet training and straining, if you do all this together, almost 75 to 80% of patients will not have any more symptoms and they do not require any further treatment. Now, as I said earlier, that if the piles are there which are coming out or they continue to bleed in spite of your medical treatment, then there are some treatments available where we do not need to go to the hospital and get admitted, but the doctor can do it in the clinic. For example, banding. Banding is nothing but a silicone band which is applied on the piles and it strangulates the piles and the piles falls down. So it's just as a outpatient procedure. You go to the doctor, he does it, or he can give an injection into the piles, which is again painless injection, and that can help in stopping the bleeding, basically. So these are the methods by which they are not hospitalized. You don't need to get hospitalized. Just in the outpatient they can be treated. And if the prides are very big and they come out, then there are again other methods. We have a stapling method, which I've been doing for maybe more than 2 decades, 2.5 decades, or maybe 3 decades also. You have nowadays the laser has come where you have to select the cases where you can do a laser. There are some other methods now which are relatively the whole treatment surgery is aimed at that after surgery the patient should be able to go back to work early. The hospitalization just for a day. We normally hospitalize just one day, and in few days you can get back to your normal work. There is some pain after surgery, but it's not mild. It's very mild. It's not like severe. But if you get operated by a qualified surgeon, you make sure that you don't land up with complications. But if you get treated by a street quack or somebody who's advertised on the railway platform or a railway track, and if you get treated by such a person, then you are sure to land up with complications. And we have seen horrendous complications from people who have been treated by such. So I would never recommend you going to such a person. So go to a proper doctor, get treated. More than 70 to 85% chances there that you will get treated without surgery.